If you answered enable rate response, you'd be correct. By enabling rate response, we are allowing the pacemaker to recognize when a patient is exerting themselves and artificially increase the heart rate. So the pacemaker itself will increase the patient's heart rate. Now, if we'd enabled hysteresis, this actually allows for slower heart rates. So we may have increased the amount of time the heart rate was between 40, 50, or even up to 60 beats per minute, but we wouldn't have had any heart rate over 70 beats per minute still, and we'd still have poor heart rate variability. Now, if we'd have changed the mode to VOO at 70 beats per minute, we would have seen a very similar graph, with the heart rate being fixed at 70 beats per minute for the whole time. Again, with this histogram, we can see this patient has chronotropic incompetence, so by just increasing the base rate to 80 beats per minute, we may make him feel a little better because his heart rate during exertion would be a little higher at 80 beats per minute. But if he started to exercise and required a faster heart rate, the base rate would not solve this issue, and the histogram would look exactly the same but between the 80 to 90 beats per minute section. So we enabled rate response, and this was his histogram upon returning to the clinic 1 month later. You can see by making that small change, we now have much better heart rate distribution. We also have a nice histogram curve which is suggestive of good pacemaker function.